kind of stool right here. Would work right away. Okay, not one of these rolling stools that you're going to slide all over the place. Because what you, Dory, yeah. Because what you want to think of, you have to think of the treatment plane. Here's our femur, here's our tib. If we have it at 20 degrees, 10 to 20 degrees of flexion, or 25 degrees of flexion, and we're going to do our posterior glide, right? That's going to be for what? This is our tib. Posterior glide is going to increase what? Flexion. Okay. We don't want, if we're thinking of our treatment plane, we don't want to be, here we are, right here, we don't want to be compressing the joint. We don't want this, right? We want to make sure we're doing our traction and doing a glide. On these, sometimes if you're not as tall, the table's not set up, it ends up looking like all you're doing is loading the joint. We need to do our traction, and really, what's important is to be able to have your elbow where it's blocked out. So if our elbow's blocked out, and we're going to do our, here we go, traction, and then our glide. So you have to visualize where the joint's going to be, because right here is different than where it's going to be here, right? So where we're going to glide. Go ahead and line this up. So this way, I was saying, is going to be easier, Jessica. Right here. So when let's say that our limitation is going to be extension, right? And the way we were doing it was a lot like our Lockman. It was a Lockman, right? But then you have to use your big biceps, or you're saying that your hands are too little because your athlete patient's too big. So what we can do here, the table's going to stabilize our convex. Right here, we can either put our hand here, we really don't need to. We can just be here. So our mobilizing hand is going to be right at the joint. We're at our 20 to 25 degrees of knee flexion, correct? We do our distraction by just pulling here, arms locked out, treatment point, and then we can do our glide. You guys see that? So right now, I'm stabilizing the convex, and I'm loading the concave, so I'm going in the same direction of the limitation. Does this make it easier for you guys? Like I think this was a lot easier for you. I show both ways, but this way, because now you're going to be able to definitely use your body weight. You should be able to, for thinking of treatment plan, your elbow's going to be locked out. We do our slight traction, and now we're going to do our glide. Make sense? So now, since we're utilizing the table, we don't have to be here trying to, we already have the table, slight traction, and then our glide. We could do a posterior glide if we, going this way, but we don't do it that often for flexion. We have it on would be supine. There is one other thing that I'd like to show. You guys don't have to do, aren't going to do this, but because this is not a loose pack position, this is going to be more close pack position. But when you're thinking flexion, and when we're thinking of a capsule, that's what we're trying to stretch, right? Increase the mobility in the capsule. Say the capsule is slit tight, that's limiting the motion. So she can't bring her heel to a foot. Normal range of motion is 135 degrees, 0 extension, right? Say that she's at 90, right here, 90 degrees of knee flexion. If she's at 90 degrees of knee flexion, and we're down here, and we're doing our glide, we're really not doing a lot on that capsule, correct? But if we took her to this position, this is a close back position. I'm just showing you guys. You guys aren't going to be required to do it. Don't worry about it. We're not going to hurt anyone with this. But this one, and then we go ahead and come up here. She was tuning me out. Go ahead and come over here. And so if you were to do this way, you could hold right here. Someone could hold. And then what I could do right here, I can do the traction, and then you glide. You see that? Traction, glide. It makes it a lot easier, but it's more functional. Right now you guys are learning with back position because it's the safest thing for you to learn. But if we're talking anything for knee flexion, it's really not that relevant because there's very seldom are you going to see someone that can't move their knee 15, 20 degrees of flexion. If they get to 90, this is where we start seeing the limitation. So 90 to 130, then this would be a good place for you guys to start. But I just want you to have that idea that you can still have them lying prone and do this one where you get the traction, think of the treatment plan, rather than just letting go over. Rather than just doing this one here. Because this is still for knee flexion, but it's a little bit harder now. Okay, we do our traction, elbow lock, and our posterior lock. You guys see that? Great. Alright, so now moving, not right here, we're skipping the hip. Okay, so we're going to move to the shoulder.